Good evening, everyone, and thanks for joining me this evening for this webinar on feline hyperthyroidism. This is the third webinar that I will do in this series, so it's great to be back and to have another feline medicine topic for you this evening. So we're going to have a little look at hyperthyroidism and discussion about this very common disease that we see really all over the world. So the first thing that I want to do is show you a new or a fairly new resource that has become available for us for some updates on hyperthyroidism in cats. And this is a set of guidelines that was published just last year by the American Association of Feline Practitioners and published in the Journal of Feline Medicine and Surgery. So if you are an ISFM member, then you'll have a subscription to the journal, or if you are an AFP member, you'll have a subscription to the journal. But even if you're not, we make all of our guidelines documents available to everybody for free, even if you're not a member. So you can access this set of guidelines either from our catvets.com website, and when you go there, just look for the link to practice guidelines and click on that link, and you will see all of the different guidelines that we publish. Our vaccination guidelines, our senior care guidelines, behavior, feline-friendly handling, things like that. You'll find them all under the practice guidelines link, including this one on the management of hyperthyroidism. Or you can also download the journal article from the Journal of Feline Medicine and Surgery website by using the web address that you can see on the slide. So if you go to that link and scroll down towards the bottom of the page, you'll see a link to a variety of articles that we have provided from the journal for free. And this will be one of the articles that you'll find that's available for free. So I hope that you'll take advantage of that set of guidelines. So before I get started, I'm going to see if I can send you the first poll. And the first poll is to ask you if you have seen a cat with hyperthyroidism within the last month. So let me know if you've seen a cat within the last month with hyperthyroidism. So I'll just wait another minute or two till we get all of our votes in there. Okay, so looks like so far, let's see what we get. It says so far most of you have not seen a cat within the last month, but a few of you have seen a cat with hyperthyroidism within the last month. Okay, so that just gives me a little bit of an idea of how common the disease is in your practice. And of course, that's going to also depend on how many cats you see in your practice, and some practices see more cats than other cats. And it will also depend on the age of cats that you see. So, for example, I've been lecturing in Central and South America a lot recently, and especially in Mexico. And they tell me that they hardly ever see a cat with hyperthyroidism. And it's because the majority of cats that go into veterinarians in those practices are younger cats. They don't see as many older cats as maybe we do in the rest of North America or in some European countries. So as we'll see in a minute, age is an important factor for how common this disease is. So it is a common disease worldwide. I really can't think of a country where we wouldn't find hyperthyroidism. And in fact, it's estimated that about 10 10% or more of cats that are over the age of 10 will be affected with this disease. So we certainly start to see much more commonly once cats are in their senior years. And it is a relatively new disease as feline diseases go. So it was first reported in the late 1970s uh, and started to appear in textbooks and in journal articles at that point. And generally over time, in most countries in the world, the number of cats diagnosed with hyperthyroidism has been increasing faster than the number of cats diagnosed with diabetes or with cats diagnosed with chronic kidney disease. And so that could be because we're screening more cats for hyperthyroidism, so it just could be due to an increased level of awareness. It could be due to increasing number of cases, increasing prevalence. It's kind of hard to say. It might be a combination of both as veterinarians become more aware of this disease and as screening tests are more available and they're more affordable and they're more commonly used, then of course you're going to diagnose more cases. So to some degree, the number of cases that you see also depends on how often you look for this disease. Same with any feline disease, really. So we don't really have a firm answer as to what causes hyperthyroidism in cats. We're going to talk about underlying etiologies in a minute, but I'll tell you what we do know about how the disease appears. So there's really a couple forms of the disease that are common. And the most common is an adenoma or an adenomatous hyperplasia of the thyroid gland. And so these are thyroid gland tumors. So they're still tumors. They're just not tumors that have a malignant behavior. So this type of adenoma or adenomatous hyperplasia really accounts for about 90% of the cases that we see. And in the majority of cats, it's bilateral disease. So it's going to affect both lobes of the thyroid gland. It initially might look like it appears just in one lobe of the thyroid gland because you might only be able to palpate one enlarged side. But eventually, the other lobe of the gland will become involved as well in at least 70% of cases. So this form of the disease is very common to a thyroid disease seen in people that's called toxic nodular goiter. And this is a disease of people that is the most, I would say, let's say the second most common cause in, at least in developed countries. So let's say North America, Western Europe, a lot of Asia. And it's primarily found in older women get this form of the disease called toxic nodular goiter. Probably in people, the most common form of thyroid disease is an autoimmune disease called Graves' disease. And as far as we know, we don't see that in cats. So we don't see that autoimmune form in cats, but we do see this adenomatous form, which is really similar to the human disease that's called toxic nodular goiter. So that's going to be the majority of cases. Unfortunately, a small percentage of cases have their thyroid pathology is caused by a carcinoma. So this is a malignant tumor, and it does have some risk of metastasis. We're going to look at some cases in a few minutes to show you. And it does seem we have some increasing evidence that suggests that it takes time for carcinomas to develop. And so it may be that cats start with the adenoma, the benign form of the tumor, and then over a period maybe of years, that benign form in a small number of cats will transform into a carcinoma. And it may be that this even happens that with cats that are on medical management of their disease, so they clinically have their hyperthyroidism controlled, but they still, again, it's a very small percentage, but does seem still to be a risk that some of those cats will transform into the malignant form of the disease and get a thyroid carcinoma. And so obviously a much more severe form of the disease than the adenoma. So thyroid carcinoma is one of the tip-offs for thyroid carcinomas is that the mass is very large. So as you can see in the cat in this picture, you can see between my fingers there how big the thyroid gland is. So the cats that we suspect of having carcinomas have a very, very enlarged gland compared to the cats that have adenomas. And when we look at their total T4 hormone levels, their total T4 levels tend to be extremely high. So they will be 5, maybe even 10 times the upper limit of normal. The other thing that might make us suspicious that a cat has a carcinoma is that they will be very poorly responsive or probably not responsive at all to medical management of their disease. So if we put them on thyroid medications, then we may see that they don't respond at all to management of the disease. So that would be another clue. And in this form of the disease, metastasis is common or possible, let's say possible. And in particular, we would see metastasis in the lungs. And so here's an example of what it might look like when we do a scintigraphy scan. We're going to talk a little bit more about scintigraphy in a few minutes. But the cat on the right side of your screen is a normal cat. And you can see the arrows that are pointing to the two normal thyroid lobes in this cat. And they're very small. And they're equal in density to the salivary glands. So you can see in the head of the cat some other bright areas, and those bright areas are the salivary glands. And so typically, so here, this bright area here would be salivary glands, and those are thyroid glands. So in a normal cat, the density of the image is about equal in the thyroid gland and the salivary gland. But in cats that have a thyroid carcinoma, you can see that the gland is very, very bright. You can barely actually see the salivary glands in this cat. So we get this very bright uptake of the contrast agent. And the gland in thyroid carcinomas, the tumor also is often multilobular. So you can sometimes see very distinct parts to the tumor. The other difference is in the location. So you can see in this cat that has a normal thyroid gland, this line is at the thoracic inlet. That's what the white line is. And so a normal thyroid gland is above the thoracic inlet. It's just below the level of the larynx where we can palpate it. But in the cat with the thyroid carcinoma, only part of the thyroid gland is above the above the thoracic inlet and palpable. You can see that the bulk of the gland is actually below the thoracic inlet where we can't palpate it. So we might not even really realize, based on palpation, exactly how big that tumor is. We would really only see it when we do something like scintigraphy. So I said that this type of tumor can metastasize. So here is a case from an article that was published in the Journal of Feline Medicine and Surgery in 2009 of a cat with a thyroid carcinoma with metastasis to the chest. So you can see the changes on the radiograph on the left-hand side of your image, that diffuse pattern in the pulmonary area that is due to metastasis. And on the right side, you can see the scintigraphy images. And so up in this area of the neck, you can see the thyroid carcinoma itself, but we also, both on the lateral and on the VD view, you see a lot of uptake of the contrast in the chest, and that's because there is tumor metastases into the lungs in this cat, and so we're seeing uptake by the tumor cells in the lungs as well. So that's what it might look like on radiographs or on imaging. The other form, which has really only been reported upon in any detail recently, is the thyroid cyst. So we do see the occasional cat with a thyroid cyst. These are far less common than adenomas. They may be either functional or non-functional, and they can appear with either the adenoma, the benign form of the disease, or with the carcinoma. So this cystic appearance to the gland can be a part of both of those presentations, the adenoma presentation and the carcinoma presentation. And so in the cat in the radiograph, this was from an article in the Journal of Feline Medicine and Surgery that just came out earlier this year. And you can see that the white arrow on the radiograph is pointing to this large soft tissue mass in the cervical region of this cat. And that is the thyroid cyst in this cat. So sometimes these cats actually present with clinical signs due to that local mass effect. So they might have dysphagia, they might have regurgitation, they might have cough, they might have some very specific clinical signs related to that mass effect. The cysts are filled with fluid, so if you do try to aspirate them, you'll get a reddish brown or a serosanguinous fluid. But unfortunately, if you try to drain the fluid, it only gives temporary relief, and they will recur. The fluid will build up again over time. So typically the best treatment for these and the best treatment for carcinoma, as we'll talk about in a minute, is radioactive iodine. There really isn't another good treatment for either of these large forms of thyroid disease in cats. So for the adenoma form, we do have multiple options, which we'll talk about in a few minutes. So here's show you another case of a cat with a thyroid cyst. This time you can see the image on ultrasound on the left-hand side of your screen. So you can see the thyroid tissue itself is shown with the solid arrowhead, and the thin arrowhead is showing us the cystic fluid that we can see that is surrounding that small amount of thyroid tissue. So as you can see on that ultrasound, they sometimes have quite a bit of cystic fluid. And the image on your right-hand side is what they might look like at surgery. They can be a little tricky to remove surgically, but that could be another option for some of these thyroid cysts. So you can see there's a very thin translucent cyst wall and a lot of fluid within that thyroid cyst. So again, these can either be in the adenoma form or they can be in the carcinoma form. Okay, so having talked about that, I'm going to see if I can send the second poll into your room here and ask you if you have ever seen a patient that you think has had a thyroid cyst or a thyroid carcinoma. Maybe you're only thinking of it now in retrospect that we've been talking about it, or maybe it was a case in the past that you were able to definitively diagnose with a carcinoma or a thyroid cyst. Okay, so just give another moment here for everybody to vote. Looks like most of you have not seen a case like this. So we ended up with the majority of you saying no, I have not seen a cat that I think has a thyroid cyst or a thyroid carcinoma, but at least one person said yes, I have seen a cat with a thyroid cyst or a carcinoma. So again, one of the tip-offs will be the size of the gland. Okay, so that's sort of the forms of the disease that we see of thyroid disease in the cat, but I thought we'd also look a little bit about what some of the underlying etiologies might be for these cases. So there are a number of theories, and it may be that some of these theories are right. It may be that none of them are right. It may be that some of them are. So some cats might be affected more by one of these underlying etiologies than others. My guess is that one or more of these play a role, and which potential etiology is more important might depend on where you live, for example, especially when we're talking about nutrition. So there are a few things that have been implicated nutritionally, and, and these may come into play depending on where you live. So for example, in some areas of the world, the soil has more or less selenium, and therefore that finds its way into some of the crops that are therefore then used in making pet foods. So same with iodine. So iodine soil content varies around the world, and that might influence what ends up in a crop, and that might influence what ends up in pet foods. Also soy. So um, and it turns out that it's not as simple as saying it's always an excess or it's always a deficiency. So it might be relative amounts of these things present in food that might make a difference. So for iodine, for example, we know you can get thyroid disease both from too little iodine and from too much iodine. So it's not always so simple that it's necessarily a simple excess or deficiency that's a cause. The other whole area of interest is in chemicals that are called thyroid disruptors. And these are chemicals that are either present in our environment, like pesticides or herbicides that are used in agriculture, sometimes used around our homes, in our own gardens, for example. Some of these have a known ability to disrupt endocrine gland function, and that, of course, would include the thyroid gland. Um, Another class of chemicals are called polybrominated diphenyl ethers, or PBDEs. And these chemicals are used as flame retardants. So they're meant to reduce the risk of fire. So these chemicals are commonly added to things like upholstery and carpeting, so that our homes and our buildings are built and furnished with materials that are flame retardant. They're also sometimes in things like children's pajamas, children's clothing, so to reduce risk to children. Uh, and there is some concern that this class of chemicals might also be a thyroid disruptor. And the other one on this slide is a chemical called bisphenol A. And that's a chemical that's received a lot of interest. It's a chemical that's added to bottles, water bottles, and food containers. So, for example, for aluminum cans, it's often the liner in the aluminum can. And it is sometimes added to plastic foodware or plastic water bottles, things like that. When we are seeing in some countries now the banning of this chemical as an additive because of concerns about its ability to disrupt endocrine gland dysfunction. That would include the thyroid gland, but it could include disruption of other endocrine glands. So there's a number of these chemicals that we get exposed to, often unknowingly, that may have an effect on endocrine gland function, and that would include the cat having a risk of disruption of thyroid gland function as well. So these things have all come of interest as helping to explain maybe why it's only been since the late 1970s that we have seen so many cases of feline hyperthyroidism. So we'll have to see as this story evolves what turns out to be the most important factors. And again, as I say, that might depend on the country that you live in. So when we look at a patient with hyperthyroidism, the classic patient has a very distinctive physical appearance. So classically, these patients would have some degree of weight loss. The longer the disease has been going on, the more weight loss. They may have a very unkempt hair coat because they do not groom very well. On physical exam, they usually have an increased heart rate and an increased respiratory rate. You might hear a heart murmur because thyroid hormone can cause some left ventricular hypertrophy. And in a severe case, a long-standing case, we can actually even see cardiac failure. That's not as common these days because we do have greater awareness of the disease, so many, probably most cats are diagnosed before they get to that phase, but certainly early on, when this disease was first becoming common, we would see cats in cardiac failure. Some patients will have high blood pressure, not all of them, but some. And then, of course, in most of our patients, we're going to palpate some degree of thyroid gland enlargement. And then clinical signs, classically, these cats will be polyuric, polydipsic, although usually what owners notice most is the increase in appetite. So these cats are losing weight despite the fact that they have a very, very good appetite. They may have some degree of gastrointestinal signs like vomiting or diarrhea, and owners often notice a change in behavior. So they may notice increased activity. Often an owner will say, my senior cat, so it's let's say it's often an elderly cat. This cat behaves like a kitten is something that owners will often say because of the increase in their metabolic rate. They often have a much more active behavior. And what we have to explain to owners is that that's not normal, of course. They may think it's lovely that their senior cat is now more playful and more active and acting like a kitten again, but that's not normal behavior for a senior cat. And we have to prepare them for the fact that when the hyperthyroidism is treated, their cat is going to act more like a normal senior cat. So we do have to prepare them for the changes that they've noticed that they might actually think are good changes that are going to disappear once the cat is treated for its hyperthyroidism. And so a key feature of diagnosis is palpating the thyroid gland. And there are a number of different ways to palpate the thyroid gland. So one is a very straightforward palpation technique where you are in the front of the cat and you will place your fingers on either side of the trachea, and you will run your fingers down either side of the trachea to palpate the size of the thyroid gland. And I showed you this technique with this patient of mine that had a thyroid carcinoma just because it's easier to see the size of the thyroid gland in that cat. So you'll be able to palpate the thyroid gland as it slips under your thumb and your forefinger as you run your finger your thumb and your forefinger up and down on the either side of the trachea of that cat. So that's one palpation technique. Another palpation technique involves palpating each thyroid gland independently. So you would take your thumb and your forefinger and run them down the groove on first the left side of the cat and then the right side of the cat. So you're palpating each thyroid lobe independently in that case. So you would do one side of the cat and with the head turned slightly towards that side, and then you would palpate the other side by turning the head slightly towards the other side of the cat. So that's another technique that you can use to palpate the thyroid gland. And then the third technique is where you position yourself behind the cat and you use two hands this time instead of just using one hand. And you use the fingers of each hand to run down each side, down the jugular furrow, the jugular groove, so you're on either side of the trachea, in order to feel the thyroid gland as it kind of slips underneath your fingers. So there isn't any one way that's better than another, and sometimes in a patient I might use more than one of these techniques so that I get a good palpation of the thyroid gland. So it's worthwhile practicing these different approaches. And I recommend that you do palpate the thyroid gland on all senior cats because that also helps you understand what a normal thyroid gland feels like. Sometimes you can't feel the thyroid gland in a normal senior cat, so it will give you an idea of what normal is like, so it will be easier for you to notice when you do palpate an enlarged thyroid gland. So not all patients have really obvious clinical signs at the time of diagnosis. So not every patient has substantial weight loss or has really dramatic clinical signs. And we see more of these patients with either very mild clinical signs or maybe even not yet developing clinical signs through the increased use of geriatric screening tests. So it's recommended now that most senior cats have a blood and urine panel done as a screening test to look for early disease detection. So we do this to try to detect chronic kidney disease earlier, other diseases of course, but one of them is hyperthyroidism. So the more routine screening you do of senior cats, the more cats you will detect based on their total T4 value that may have very mild or not very obvious clinical signs. And that's great because it's an opportunity to prevent those cats from getting very sick with their thyroid disease and to intervene very early in the course of disease, which is always what we want when we're treating any disease in our patients. So that's a good thing when we can diagnose those cats very early. We do have to remember that there are diseases that have very similar clinical signs: weight loss, polyphagia, polyuria, polydipsia, sometimes GI effects like vomiting and diarrhea. And these are diseases that also occur in the same age group as cats with hyperthyroidism. So we do need a good workup on these cats to look for other possible concurrent diseases. So I think the most common ones there would be diabetes mellitus, gastrointestinal disease, especially inflammatory bowel disease or lymphoma, neoplasia, and chronic kidney disease. So we want to make sure we have the right diagnosis. And we also might see a cat that has more than one disease at the same time too. So that's going to, of course, change our treatment plan. It might change the prognosis, and it certainly matters to the owner if the cat has more than one disease that we're dealing with. So how do we make a specific diagnosis of hyperthyroidism? So, of course, in the exam room, we may have an index of suspicion based on the clinical signs, if the cat does have any, and what the owner tells us historically about what they've noticed in their cat. Physical exam findings, as we've already mentioned, and we should always do a blood pressure assessment on senior cats. Hypertension is a common disease in senior cats, and it's commonly associated with diseases like chronic kidney disease and hyperthyroidism. So it should be a routine part of evaluation of any senior cat, regardless of whether we think they may have a disease or not. So we may be very suspicious based on what we can do in the exam room. But of course, there are some routine laboratory tests that we want to do on these cats. Again, we want to both get a diagnosis of hyperthyroidism, but we also want to look for concurrent diseases. So these cats with the type of clinical signs that we mentioned should have a complete blood count done, should have a serum chemistry panel, and should have a urinalysis done as a minimum in order for us to get a complete diagnosis on these cats. And then we have some thyroid-specific tests, of course, that we can do. And we'll talk about some of these in more depth, but probably the most commonly done is the total T4. That's widely available, so we'll talk a little bit about more about that. Some labs, of course, will offer you a thyroid panel where you can get a total T4, a free T4, maybe a TSH. It kind of depends on the lab, but they might offer you a variety of tests in a panel. We're going to talk about a T3 suppression test in a few minutes. I've already shown you some scintigraphy images, and we'll talk about that a little bit more. But probably most cats get diagnosed on the basis of an elevated total T4. That would be the most common way they get diagnosed. So because we have a wide array of tests available to us, I thought I would just ask you about your experience. I'm going to see if I can send you another poll that is going to ask you what you most commonly rely on for the diagnosis of hyperthyroidism. And this might depend on what your lab offers you. So are you typically using a thyroid hormone panel that your lab might offer, or are you more typically just running a total T4 by itself? There's no right or wrong answer. I'm interested in what your experience is, and to some degree, of course, what your labs might offer you. We'll talk about some of these tests in a little bit more depth in a moment. So I'll just wait, see if we get any other votes in there. Looks like most of you have voted there now. Okay, so it looks like the majority of you are using a total T4 alone, although at least one person is using a thyroid panel. Okay, so that's what we have available to us for thyroid specific tests. So because we're also submitting a serum chemistry panel and a CBC, there may be some clues. They're not thyroid disease specific, of course, but there may be some clues on that panel. So we might see elevated liver enzymes. We might see azotemia that could be pre-renal because our patient's dehydrated. It could be renal. We're going to talk a little bit about chronic kidney disease and hyperthyroidism in a few minutes. Sometimes we see increased phosphorus in these cats. Not uncommon at all to see decreased potassium because of the polyuria and polydipsia, so they have potassium loss. And some of these cats will have a bacterial urinary tract infection, and it's often occult. So these cats often have no clinical signs of their bacterial urinary tract infection. So we typically would have to do a urine culture in order to determine that. So I mentioned that probably the most common way this disease is diagnosed, and probably your best screening test, is a total T4. It's a simple test. It's simple for labs to run, unlike some of the other thyroid hormone tests. It's generally the least expensive. Probably every lab can run it for you, and it's going to diagnose the majority of cases. We'll talk about what to do when we have cases that are a little bit harder to diagnose. So this is called a total T4 because it measures your free and your protein bound, which is the bulk of the T4. Only the free T4 is the part that crosses cell membranes, is converted into T3, and then becomes metabolically active in the target tissues. But we can certainly measure that total T4 as a very robust and routine screening test in our patients. But we will meet some patients that we have suspected of hyperthyroidism, but when you get the total T4 back, the value is normal. And typically the total T4 is in the upper end, maybe the upper 20% or so of the reference range in these cats. So it wouldn't be a cat that has a very low T4 or mid-range. These are usually in the reference range, but at the upper end of the reference range. And one of the common reasons this might happen is because the cat has some concurrent disease that interferes with protein binding. So some gastrointestinal diseases, for example, interfere with protein binding. And so because we're measuring total T4, including the protein bound component, that might give you a falsely low value for your total T4 when in reality it's higher. So we're going to talk about what do you do if in your mind you thought this cat was likely to have hyperthyroidism, but the total T4 was in the upper end but within the normal reference range. So of course we do want to go back and do a careful thyroid gland palpation in these cats. If we really didn't palpate a gland enlargement on physical exam, we would want to go back and make sure that we repeated our palpation to convince ourselves whether we palpate an enlarged thyroid gland. Remember from the scintigraphy images that I showed you, very large glands sometimes drop below the thoracic inlet where we actually can't feel them. So if the cat is stable, so not very sick, and it's not an urgent diagnosis, we could just wait. We could wait 2 weeks, maybe 4 weeks at the most, and just repeat a total T4, but probably do a free T4 at the same time, and then see what happens with that second set of test results. Often the diagnosis will be confirmed on the second set of test results. So that's an option if it's a stable patient and getting the diagnosis isn't urgent. So free T4 can help us with these cases when the total T4 is near the upper end of the reference range, but we still suspect hyperthyroidism in those cats. So that's where it can be really useful. So it's not terribly useful as a standalone screening test because some older cats and some cats with non-thyroidal disease will have increased free T4. So this graph is from a paper that Mark Peterson published a number of years ago now, looking at, this is serum-free T4 on the vertical axis. So this is a group of normal cats, and the blue area, the blue block, is the normal reference range for free T4. So we would expect normal cats to be in the normal reference range, as they are. And this group on the far right, sorry, we'll go to this group in the middle, the hyperthyroid cats, you would expect them to all have a high free T4, and they do. But this is the group that sometimes confuses us. So these are cats that are not hyperthyroid, but they do have other illnesses. And of course, the bulk of them have a normal free T4 because they don't have hyperthyroidism. But there are a few of them that have an increased free T4 because they have some concurrent disease. So that's why we never look at free T4 by itself, but it can be useful to combine with total T4 when we're looking at those cases that are a little bit more of a diagnostic challenge. The other hormone we can look at is canine TSH. So there is no feline TSH assay. There is a canine TSH assay, and it will be suppressed in most hyperthyroid cats. So if you're running a thyroid panel on one of these equivocal cats, you could look at the TSH. So it will be very sensitive because it is suppressed below normal in most hyperthyroid cats, but we say it's not a very sensitive test. And the reason we say that is because it's not, it's a canine assay, so it has its pitfalls when we're using it in cats, and it will be suppressed in about a third of normal cats as well. So what we really need is a good feline assay on the market. But when we're trying to look at these equivocal cases, it can be useful to look at not just the total T4, repeat that, but it could be useful to look at some of these other thyroid hormones and see if we get some additional information from looking at those. We should look for concurrent non-thyroidal illness because we know that that will have an impact on the total T4. So we need to go back to these equivocal patients and see, do you have a concurrent disease like chronic kidney disease or diabetes or gastrointestinal disease? And the reason we do that is it's well known that some non-thyroidal illnesses will suppress total T4 when it should be high, but it'll move it down within the top end of the reference range. So we do see a fair number of cats like this that are hyperthyroid, but because they have a concurrent illness, their total T4 is suppressed just to within the upper limit of the normal reference range. And again, this is often due to protein binding abnormalities from things like concurrent GI disease. We might also see this on cats that are being treated with glucocorticoids like prednisolone, for example, that affect protein binding. So we want to keep that in mind when we see these diagnostically difficult cases. Okay, so there are a number of different routes we can take to look at these diagnostically difficult cases. So before we talk about one of these other tests, I'm going to see if I can send another poll into the room here and ask you if any of you have ever performed a T3 suppression test. So we're going to talk about that test in a minute. It's a relatively easy test to perform, not performed as often as it could be, I think, which is why we're going to talk about it. So I'm just interested to see how many of you have ever done this test yourself. Before we talk about it, we'll just give another moment there for a few more votes. Okay, so it looks like most of you have voted, and the majority of you have said no. I have not used a T3 suppression test. Okay, so let's talk about what a T3 suppression test is. So this is another type of test that can help us with these equivocal cases. And it's fairly easy to do. The downfalls are, of course, that the test takes 3 days to do. We have to run it over 3 days. And it requires the owner to give pills to the cat. So in this test, what we're going to do is give the cat T3 orally, and depends on the country, but typically there's a T3 is available as liothyronine under various brand names like Cytobin or Cytomel or Sinomel, but it's liothyronine T3. So it comes in a tablet, 25 microgram tablet. And what we do is on the first day, before we give the first tablet, we collect a baseline serum sample and we freeze it. Then the owner gives the cat 3 doses of liothyronine on the first day, so every 8 hours, so 3 doses on the first day. Then on the second day, the owner gives the cat 3 more doses. So now we've got 6 doses into the cat. And then on day 3, the 7th and last dose is given in the morning. And then about 4 hours later, the owner comes into your practice and you draw the second serum sample. And you're going to submit both serum samples together. You're going to submit paired serum samples. And you're going to ask the lab to measure T3, free T4, and total T4. So that's how we use the test. So it is relatively simple, and the idea is if you give extra T3 to a patient, you should reduce the T4 levels through a normal negative feedback loop. So if you don't have hyperthyroidism, your total T4 should be lower in the second sample than it is in the first sample. But if you have hyperthyroidism, you have a tumor on your thyroid gland that does not respond to negative feedback, and you will not see a lower total T4 in the second sample. That's how it works. So here's test results from one of my patients just to show you how this works. This is a cat named Cecil who we thought had hyperthyroidism, but you can see that in his baseline samples, his total T4 was 51. So he was within the normal range, but like most of these cats, his total T4 was at the upper end of the normal range. And his clinical signs were very compatible with hyperthyroidism, and we couldn't see any other cause. So we were suspicious. So that's why we did this test. So you can see there is his initial T3. We would expect the T3 level to go up because we've been giving him 7 doses of T3. We're going to look at what the free T4 and the total T4 levels do in this cat. So that's his baseline sample, and here is his test results following administration. So you can see that his T3 increased from 2.17 to 5.51, as it should. So that tells us the owner was able to give all of the medication to the cat. But if we look at the total T4 and the free T4, there was no effect. So we would expect that total T4 to be less than 50% of the starting or baseline T4 to see normal suppression. So we had no suppression of either total or free T4, so that gives us a diagnosis of hyperthyroidism in that cat. So that's how we would use a T3 suppression test. And of course, another option for these equivocal cats would be scintigraphy, that if it's available to you, not widely available, so not widely used for this purpose, but as you saw in some of the images I showed you earlier, we would be able to diagnose it based on the radionuclide uptake in the thyroid gland. So we would sometimes use it for borderline cases or diagnosing the carcinomas, things like that, if it's available to you. So just to show you again, here is a cat, a scintigraphy picture of a cat that is normal. So you can see the radionuclide uptake in the salivary glands and in the thyroid, and they're about equal brightness. So we can calculate the uptake in those glands and compare. And then this is a cat with hyperthyroidism, and you can see dramatically increased uptake in that. This is a thyroid adenoma, so that more common benign form of the disease, and you can see dramatic uptake in the thyroid adenoma. So that's what it would look like in those patients. Okay, so let's start talking about treatment, and I'll do that by talking about a patient of mine named Trouble. So Trouble was presented to us at 11 years of age, a spayed female, domestic long-hair cat. Her owner presented her to us on that day because she'd noticed some recent changes. Trouble was much more energetic but hyper excitable. Her behavior was dramatically changed. And then on the day that the owner brought her in to see us, she noticed that Trouble had a head tilt and she tended to fall to her left side when she was walking. So that's what prompted the visit into the clinic. On physical exam, we did palpate bilateral thyroid gland enlargement. She had an elevated heart rate and she did have a heart murmur that she had not had before. And her systolic blood pressure was high at 200 millimeters of mercury, and she'd lost weight. She had about 13% weight loss since her previous visit. So we did a CBC, chemistry panel, and a urinalysis. I'll just show you some of the results in the interest of time. So her values are in the middle column with the normal ranges on the right-hand side for you for comparison. So her kidney values were normal. Her alkaline phosphatase was normal. But as we often see in these hyperthyroid cats, her ALT was elevated. And that's a secondary hepatopathy. And once these cats are treated, typically their liver enzymes go back to normal. If they don't, then they must have another disease. So we would expect that to go back to normal once the cat is successfully treated. And of course, we had a very high total T4. The upper end of the reference range for our lab is 60, and she was about 88. So her diagnosis was hyperthyroidism with high blood pressure, and combination of the two probably causing the clinical signs. So we would need to treat both of those problems in her. So our goals of treatment in these hyperthyroid cats are, of course, to restore their thyroid hormone levels to normal, but we also want to minimize adverse effects of treatment, which we'll talk about, and we want to avoid these cats becoming hypothyroid, and we'll talk about why that's so important in a minute. And fortunately, we do have 4 treatment options. So depends on what's available in your area. If you have radioiodine available to you, that's one of the cure options. The other cure option is surgical thyroidectomy. And then we have 2 control options, either through dietary therapy or drug therapy. You may pick a different choice depending on the patient, depending on their age, on their concurrent diseases, whether the owner can give medication, whether the cat will accept dietary therapy. So these all work. It's important that we tailor the therapy to what is appropriate for that individual cat and owner. So if you have radioiodine available in your area, it destroys that functioning thyroid tissue by emitting beta particles, but it spares normal thyroid, and it also does not affect non-thyroid tissue. So it's very targeted treatment. It does have a very high cure rate. Adverse effects, and most cats would not need medication afterwards, although the one situation where they might is if the treatment makes them hypothyroid, which we'll talk about in a minute. So the disadvantage is, of course, that it is a special facility and it might not be available to you. It does require a period of hospitalization that varies from country to country. There is a period of quarantine at home and limiting human contact afterwards. There is a risk of hypothyroidism, depending on how the facility does the treatment. And of course, it's an irreversible treatment for that patient. So there are some disadvantages. Increasingly, we're using lower doses of radioiodine. So this paper was just published earlier this year in the Journal of Veterinary Internal Medicine. That journal is now all open access, if you weren't aware of that before. So you can access all of their articles online for free. So this article looked at a low dose radioiodine 2 millicuries compared to what has been a standard dose of about twice that at 4 millicuries, and found that lower doses are still very effective, but it greatly decreases the risk of hypothyroidism, which we now know we really want to avoid in these cats. So we're using lower doses of radioiodine typically than we used in the past. So the other cure option, if radioiodine isn't available to you, is surgical thyroidectomy. either both glands done at the same, both lobes of the gland at the same time, or a staged procedure where one lobe is done and then the other lobe is done later on. That reduces the risk of disturbance of the parathyroid gland, which is why sometimes people choose that procedure. It also has a very high cure rate. It has a little higher relapse rate because if we leave any amount of thyroid tissue behind, then we will get a relapse. Of course, no special equipment is needed. It's a relatively simple surgery and it works quite rapidly. So it has lots of advantages in our patients. Does have some disadvantages. Does require general anesthesia, usually only a day or two in the hospital. But we have to be very careful we don't disturb the parathyroid gland and disrupt calcium homeostasis. Like radioiodine, it's irreversible. But a patient must be stabilized with medication before surgery so that they're a good candidate. We don't want a tachycardic, unstable patient undergoing general anesthesia. And then, of course, the medical options. We can use dietary therapy. I think the only diet on the market is YD. I think it's available in most countries in Europe now. It is used as a standalone therapy. We never combine it with anti-thyroid drugs. That gives us a dangerous drop in T4 level. So it is a standalone therapy that we can use in some patients. It is a simple treatment, so that's an advantage. It's just a treatment through food. Has a pretty good response rate, probably in the high 80%, but the cat must be on the food and stay on the food lifelong. And for patients with concurrent chronic kidney disease, this might be a good choice. It is safe and useful in those patients as well. Of course, the disadvantages are the cat has to eat this food and no other food. And what if the cat develops another disease down the road where we would want to change the diet? Then we're going to have to come up with another treatment plan for that cat. So all of these options have their pros and their cons. And of course, probably the most common treatment is anti-thyroid medication, either using carbimazole or methimazole. In many countries, both drugs are available. In North America, we only have methimazole, so we only have experience with one of these drugs, but they're very similar. So we can talk about the benefits and disadvantages together. Again, a very high response rate. They can sometimes be available in different formulations, which might be useful. The patient is treated at home. We have a lot of ability to adjust the dose, so that's a big benefit. But of course, it's lifelong treatment. The owner does have to give pills. It does require some ongoing monitoring. Some patients have adverse effects, which we'll talk about in a moment. And then you remember that I mentioned we do have a concern that in a very small number of patients over a long period of time, they might develop a carcinoma from their adenoma, even if they're under treatment. So I think that risk is low, but it's real, and it's something that we should at least mention to owners. So some cats do get adverse effects from anti-thyroid medication. Vomiting would be common, a facial rash, like you can see in this cat, often on the face or around the eyes, like on this patient. A small percentage of cats will get thrombocytopenia or leukopenia, and a small percentage of cats will get hepatotoxicity. So in most of these cases, we have to stop the medication. It's not going to go away with time, and we won't be able to adjust up the dose. So there are some patients that just cannot tolerate these medications. So in Trouble's case, we went ahead and put her on oral methimazole. Most cats do need twice-a-day treatment with methimazole. And because she had high blood pressure, we started her on amlodipine. With the hopes that once her thyroid hormone level came back down to normal, that her high blood pressure might resolve and we might be able to stop her amlodipine. So our hope was that the high blood pressure was totally related to her hyperthyroidism. So 2 months later, she came back. Her weight was stable, her clinical signs had resolved, and indeed her hypertension had resolved, and we were able to stop her amlodipine, and her T4 was now well in the middle of the reference range. So we saw her, typically we see cats 2 to 4 weeks after we start treatment, and then again about a month later, so this was at her 2-month recheck. So she did very well. If she had problems with her medication, then we'd have to talk to the owner about changing the type of drug. And then 11 months later, her T4 is still in a good place in the reference range. We'll talk about where you want the T4 to be, and her weight, she gradually put on weight as her disease was resolved. So that does bring up the question of where do we want the target T4 to be? This was a study done in practitioners in the UK asking them where do they pick their target T4 level when they're treating cats with hyperthyroidism. And so you can see that about 50% of the vets said they want the total T4 to be in the lower half of the reference interval. About a third of the vets said anywhere within the reference interval is fine. I don't care if it's low or high. About 14% said, I want the total T4 to be in the upper half of the reference interval. And then a small number either said, I want it above or below the reference interval. So it's just kind of interesting to see what opinions are. So I'll show you what the recommended total T4 is for a target when we're monitoring cats. And that is to have it in the bottom half of the reference interval. So if your reference interval, let's say for my lab, it goes from 13 nanomoles per liter up to 52. In the other units, that would be 1 to 4. And so if we pick this line as the middle of the reference interval, we want the cats to be in the lower end of the reference interval. So somewhere between 10 and 30 nanomoles per liter, or 1 to 2.5 micrograms per deciliter. And that matches what most normal senior cats would be. Most normal senior cats would be somewhere in here. So we don't want them too high and we don't want them too low, because both of those situations have deleterious effects on the kidney, which is why we're concerned about what the target interval is. So we do see cats that either have chronic kidney disease at the time of their diagnosis with hyperthyroidism, and it becomes apparent after treatment. So these are cats that we may not have known had chronic kidney disease because the azotemia was masked by the effects of hyperthyroidism. That hyperthyroid state increases, abnormally increases, glomerular filtration rate, and it may make the BUN and creatinine look abnormally low. So when we do treat these cats for their hyperthyroidism and their T4 comes down within the reference interval, then we might see the urea and creatinine increase. So it's not that treatment caused the increase or caused the chronic kidney disease, we simply revealed it by returning the cat's glomerular filtration rate to normal levels. So those are the cats that we say we have unmasked chronic kidney disease. So their azotemia has developed after treatment because they had pre-existing. So we would go ahead and stage and treat their chronic kidney disease according to the IRIS guidelines. We talked about that in one of my first seminars with you. So we do want to make sure we have both diseases under control. The other group of cats are cats that are azotemic at the time of diagnosis. So we already suspect, and that's not pre-renal, not from dehydration, but they're azotemic and we already suspect they have chronic kidney disease. We still have to treat both of those diseases at the same time, and we would still go ahead and treat their hyperthyroidism and aim for that target total T4 to be the same as for any other cat. So in other words, to be in that lower half of the reference range. That will actually be beneficial to their kidneys and make their chronic kidney disease easier to treat by controlling their hyperthyroidism. So we never want to avoid treating hyperthyroidism. In the past, some vets have thought that if we allow their T4 level to be high or a little bit high, it will make the BUN and creatinine look lower. But that's a very false sense of security. That's a very artificial lowering. And what we're actually doing is continuing to put stress on the kidney, and we're actually making the chronic kidney disease advance faster. So it's really important to understand that concept, that we do need to treat these cats, whether they've got pre-existing disease or not. So in that realm, I thought I'd ask you, I'm going to send another poll, hopefully in, and I'm going to ask you, what's the most common concurrent disease that you see in cats with hyperthyroidism. So are you likely to see chronic kidney disease? Is it diabetes mellitus? Do you see neoplasia? Do you see gastrointestinal disease? And I realize that you might see all of these, and some patients have more than one disease. But I'm curious in general which of these diseases might come out on top as the most common concurrent disease that you see. So we'll give everybody just a minute more there to reply. Okay. Okay, so it looks like most of you have answered, and everybody has said chronic kidney disease, and so that's no surprise to me because that's certainly the case for me as well, that that's the most current disease that I see. So we do have to be careful to avoid hypothyroidism, so that would be a total T4 that's below 10 nanomils per liter or under 1 microgram per deciliter, because that is going to reduce glomerular filtration rate, reduce renal blood flow. It'll have a deleterious effect on the kidneys, and it will reduce survival time. So it's very important to avoid that. So we can adjust our methimazole or carbimazole treatment to avoid that. The other situation where it can occur is cats that have radioiodine treatment. So about 30 days post-treatment, we want to look at their total and their free T4, their TSH, and their serum chemistries. Partly we're looking to see if we have unmasked chronic kidney disease, and we're also looking to make sure that they're not becoming hypothyroid. That's really important. So if we do see at that 30-day checkup that there is a total T4 that's in the lower 1/3 of the reference range, so a T4 that is a little bit lower than we would like, and an increase in TSH, that would be a diagnosis of mild hypothyroidism. But if the creatinine is okay, it's not trending upwards, we might choose to wait a little bit longer. So we might only monitor those cats, then recheck them at 3 and 6 months and just see what's the trend. What's the trend in the creatinine, what's the trend in the total T4, and what's the trend in the TSH? Because it takes a little bit of time for that to equilibrate. Takes a little bit of time for that all to stabilize. So we might, if they only have mild signs and the creatinine is stable, we might elect just to monitor. But if we do have evidence of chronic kidney disease or that creatinine is trending upwards in those cats, then they do need to go on levothyroxine. So these cats will need to take thyroxine supplement, and that is likely to be for the rest of their lives. We have to get that total T4 into that lower half of the reference range so that we don't have deleterious effects on the kidneys. That's really, really important. So that's why when cats have radioiodine treatment, I never promise the owners that there won't be any need for medication afterwards, especially in facilities that are still using those higher doses of radioiodine. We do have to watch these cats for hypothyroidism and diagnose and treat it if it occurs, so that we don't cause problems with their kidneys ongoing. So monitoring in general, whether you're on drug or dietary therapy, every 6 months these cats do need a physical exam, good medical history, so we can evaluate for control of their disease or development of new diseases, and a periodic complete blood count chemistry panel urinalysis, and then I typically monitor them with a total T4 when they're on drug or dietary therapy, trying to keep them into that target range, and of course avoiding hypothyroidism in these guys. Okay, so in summary, common disease found in cats all around the world. How common, of course, depends for you on how much screening you're doing, proactive screening you're doing of senior cats, and how many senior cats you see in your practice. The good news is that it is a very treatable disease. We have a lot of treatment options, and you can tailor those treatment options to your patient, and of course depends on whether you have options like radioiodine available in your area. But above all, we want to avoid hypothyroidism in these patients. So that's something we've become aware of in recent years that we didn't used to think about in the past, and now we know how important it is to avoid hypothyroidism in these patients. So I just want to say a quick thanks to a few colleagues like Dr. Peterson, who has shared some of the scintigraphy images with me, and a few of my other colleagues who helped with images for